Anatomy of the 7th and the 8th cranial nerve, the facial and the vestibulocochlear nerve. Well, the facial nerve is the 7th cranial nerve. It runs its course from the pons to the parotid gland. It is a mixed nerve. The sensitivity is also called the nerve of Wisberg. Well, if we talk about the course of the facial nerve, it is divided into three parts: the intracranial, the intertemporal, and the extracranial part. This is the intracranial part, the intertemporal, and the extracranial part. Well, if we talk about the intracranial part, it is a 15 to 17 mm in length. It originates from the facial motor nucleus, which lies in the lateral portion of the anterior pons. It hooks around the nucleus of the 6th abducent nerve. Here we can see how it hooks around the abducent nerve. This is the abducent nerve and this is the facial nerve. It exits the brainstem at the pontomedullary junction, posterior to the 5th trigeminal nerve. Then crosses the cerebropontine angle with the 8th nerve and the nerve of Wisberg. It enters the internal acoustic meatus then. Now, as in the intertemporal part, there are 4 segments: the meatal, the labyrinthine, the tympanic or the horizontal segment, and the mastoid or the vertical segment. According to the lengths are 8 to 10 mm. This is the shortest, 4 to 4 mm, and the narrowest. And the tympanic or the horizontal segment is 11 mm, and the mastoid or the vertical segment is 13 mm. Now the meatal segment, which is 8 to 10 mm, it is a segment inside the internal acoustic meatus. The superior and the inferior vestibular nerve lies immediately posterior and inferior posterior to the facial nerve respectively. The cochlear nerve lies caudal to the facial nerve in the ISC. Here we can see this is the Bill's bar. Here we can see posteriorly lies the superior vestibular nerve. This is the inferior vestibular nerve. This is the horizontal crest. Here is the facial nerve and below is the cochlear nerve. Now comes the labyrinthine segment. It extends from the internal acoustic canal to the geniculate ganglion. The facial nerve enters into the segment via the meatal foramen. It is the narrowest part in the canal and measuring about 0.68 mm. It is the narrowest and the shortest segment of the nerve and having a tortuous course. Dense and acronised bands encircles the nerve at the lateral end of the ISC, causing an anatomical bottleneck of the nerve. In the edema of the nerve may cause the Bell's palsy. The nerve makes a sharp posterior turn, 75 degrees, at the geniculate ganglion, also known as the first genu. Here we can see how this is the turn of 75 degrees. This is the geniculate ganglion and this is the horizontal portion, the tympanic segment of the facial nerve. Now the horizontal segment, which is 11 mm, it extends from the geniculate ganglion to the just above the pyramidaleminence. It runs posteriorly, making the superior margin of the oval window and lies below the lateral semicircular canal. So these are the surgical markings. Well, we have to understand that it runs posteriorly and makes a superior margin of the oval window. So it lies between the oval window and the lateral semicircular canal, where the oval window is below and semicircular canal, lateral semicircular canal is above. Now from there it takes a turn, known as the second genu, and gives a branch to the stapedius muscle. And the role of the stapedius muscle is basically to dampen the loud noise, and the palsy of this muscle may lead to hyperacusis. Now this is the image showing the first and second genu of the facial nerve. The first, the horizontal part, and the second genu. So this is the horizontal portion. This is the nerve in the internal acoustic meatus. This is the first genu, then the tympanic part, the horizontal part, then the vertical part. This is the second genu. So, and here the nerve is coming out of the stylomastoid foramen. Then the extracranial part starts. The vertical segment is 13 mm from the pyramid to the stylomastoid foramen. It gives the chorda tympani branch in this segment and exits the temporal one via the stylomastoid foramen lying between the mastoid tip and the styloid process. Now the extracranial part extends from the stylomastoid foramen to the terminal of its peripheral branches. In the parotid gland, the nerve divides into temporofacial branches and the cervicotemporal branches. In temporofacial branches, it gives tympanic and the zygomatic. This gives a temporal and the zygomatic. So this is the temporal and this is the zygomatic branch. So this is the temporofacial branch here. And in cervicotemporal branch, it gives the buccal, marginal mandibular and the cervical. The buccal, the marginal mandibular and the cervical branch. Here is the cervical branch. Now here we can see all the branches of the facial nerve. This is the nucleuses, the superior salivatory nucleus, the motor nucleus, the solitary nucleus. So from here the nerve moves in the intracranial part, then into the internal auditory meatus, where starts the intertemporal part. Then there comes the geniculate ganglion, from where it gives the greater petrosal nerve to the pterygopalatine ganglion. Then it moves downwards, then give the nerve to the stapedius, to the muscle. Then the chord and tympani, which further give branches and supply the anterior 2/3 of the tongue, the lingual nerve. Then from the stylomastoid foramen, it gives the nerves to the digastric nerve to the stylohyoid and the posterior auricular branch. And the extracranial branches are the temporal, zygomatic. These all are the extracranial branches. Then the other extracranial branches are the temporal, zygomatic, buccal, mandibular and the cervical. These are facial motor branches. Well, if you talk about the blood supply of the nerve, in the cerebropontine angle, it is supplied by the ICA, the anterior inferior cerebellar artery. In the internal auditory canal, by the labyrinthine artery. The geniculate ganglion, the superior petrosal artery, and the mastoid and tympanic segment, the stylomastoid artery. We'll talk about the level of the lesions, the central facial palsy and the peripheral facial palsy. The clinical the features are the paralysis of only the lower half of the face on the contralateral side. So the forehead wrinkles are retained. Whereas in the peripheral facial palsy, the lesion at the level of the nucleus, associated with the palsy of the sixth nerve, the lesion at the CP angle, so vestibular and the auditory defects involving the 5th, 9th, 10th and 11th nerve. One needs to remember in the peripheral facial palsy, one half of the face is paralyzed. There is incomplete eye closure, the wrinkles over the forehead gone on the same side, drooling of saliva, the patient gives us complaints. Now here we can see, according to the lesions, how the symptoms will be there. So transaction of the facial nerve at different levels. So if the transaction is at the level 1, there will be a loss of lacrimation. At level 2, the loss of stapedial reflex. So here we can see that the transaction is before the nerve to stapedius. So all the loss of stapedial reflex, loss of taste of the anterior 2/3 because chordae tympani, stapedial, the nerve to stapedius and the other nerves are involved. So we will get the loss of stapedial reflex, the loss of the anterior, the taste of the anterior 2/3 of the tongue, lack of salivation, the paralysis of muscles of facial expression. Because all these nerves are infected, the temporal, zygomatic, buccal, these supply the motor roots to the muscle of the muscles for the facial expression. And the chord and tympani is also gone at this level. So the lack of salivation is also there because it supplies. Now comes the Bell's palsy. It is a sudden paralysis of the facial nerve at the stylomastoid foramen. Symptoms occur on the same side. So what we will see, this is the peripheral facial palsy. See, we can see there is an inability to wrinkle the brows. This drooping eyelids, inability to close the eyes, inability to puff cheeks, no muscle tone, and drooping of the mouth, inability to smile or pucker. So upper motor neuron palsy will affect only the lower part of the face, that of the contralateral side. Symptoms are seen in the opposite side of the injury. So lower motor neuron palsy affects both upper and lower part of the face, and symptoms are seen on the same side of the injury. Again, this is the course of the facial nerve. This is the horizontal or lateral semicircular canal. This is the horizontal portion of the facial nerve. This is the vertical. So this is the geniculate ganglion, which gives the greater petrosal nerve. This is the internal acoustic meatus. We can see how the facial nerve runs above the oval window. Then it takes a turn. The facial nerve runs behind the pyramid and the posterior tympanic sulcus, and runs behind the tympanomastoid suture. And the nerve leaves the mastoid at the anterior end of the digastric ridge. So these are the surgical landmarks. One need to remember that the facial nerve lies medial to the short process of incus and processus cochleariformis. It demarcates the geniculate ganglion, which lies anterior to it. So vestibulocochlear nerve. Now let's talk about the vestibulocochlear nerve. It is the 8th cranial nerve. It has two components, the vestibular and the cochlear component. It is a pure sensory nerve. The vestibular nerve affects the afferents from the semicircular canal, utricle and saccule, whereas the cochlear nerve afferent from the cochlea. It is responsible for maintenance of the balance, and the cochlear nerve is responsible for hearing. The course of the nerve, it originates from the lower border of the pons, passes forward and exits the cranium via the internal auditory meatus along with the motor and the sensory root of the 7th nerve, which lies superior to it. The nerve splits into two in the distal aspect in the IM, vestibular nerve and the cochlear nerve. Vestibular nerve lies posteriorly to the facial nerve. The vestibular nerve, the fibers of the nerve are processes of the cell in the vestibular ganglion, which are located in the IM. Peripheral processes arises from the neurons in the ganglion supply end organs in the vestibular part of the membranous labyrinth. Central processes of the neurons in the vestibular ganglion form the vestibular nerve entering the brainstem, which end in relation to the vestibular nuclei. Now here we can see the superior vestibular nerve, the inferior vestibular nerve and the posterior vestibular nerve. The superior vestibular nerve, basically the superior and the lateral semicircular canal, utricle, macula and the superior saccular macula basically supplies. The inferior vestibular nerve, inferior saccular macula, and the posterior vestibular nerve, posterior semicircular canal. Now comes the cochlear nerve. The cochlear nerve is made up of central processes of neurons located in the spiral ganglion. The peripheral processes of the neurons of the spiral ganglia reach the organ of corti, through which sound is ultimately perceived in the auditory area of the cerebral cortex. Now this is the auditory pathway. The first neuron of the pathway are located in the spiral ganglion. Peripheral processes innervate the spiral organ of corti and central processes from the cochlear nerve. The second neuron lies in the dorsal and the ventral cochlear nuclei. Most of the axons crosses to opposite sides in the trapezoid body and terminates in the superior olivary nucleus, which forms the fibers and nucleus of the trapezoid body and the lateral lemniscus. Third nuclei lie in the superior olivary nucleus. Axons from the lateral lemniscus and reach the inferior colliculus. And the fourth neuron lie in the inferior colliculus, passes through the inferior brachium to reach the medial geniculate body. And the fifth lie in the medial geniculate body from the auditory radiation, passes through the sublentiform part of the internal capsule to reach the auditory area 41 and 42. Now the vestibular pathway. Vestibular receptors are the macula of saccule and utricle, static balance, and cister of the ampullae of the semicircular duct, kinetic balance. Three nerve divisions are peripheral processes of the vestibular ganglion situated in the IM. Central processes arises from the neurons of the ganglion. From the vestibular nerve ends in the vestibular nuclei. Second neuron in the pathway of balance lies vestibular nuclei, and these nuclei send fibers to the archicerebellum through the inferior cerebral peduncle motor nuclei of the brainstem through the medial longitudinal bundle, and anterior horn of the spinal cord through the vestibulospinal tract. Thank you.